Good afternoon, ladies and gentlemen. I want to share with you the experience we had in our practice, Dr. Hailing and me. And as you have seen on the program, the time is short to show you everything or many things we have been seeing, but there are also the Meet expert session where you can go and have a look on the recent development. So if next year ISUOG will have its 25th anniversary, we'll have on 3D ultrasound also 25 years history where this is how things started, where for one volume, one complete night was needed to calculate the images. Today we are having very quick image calculation within several volumes per second. So you see that technology is not only in private life, but also arrived in medicine. And what is happening now since several years that we start by learning to do ultrasound by looking to the face, but very soon we know that we can use it for several things like tomography imaging, OmniView, VCI, calculate volumes, having a projection and display. And all these things are really now like what we know as an app in a machine. You have a volume and you can choose this or that feature to start. And Bernard Benoit, for me, the pioneer on the field of ultrasound, gave me this slide. And when we are visiting a course together, he shows such a slide and say, you know, ultrasound 3D is like a Swiss knife. And this is where you can get a volume and you can cut and do everything you want. And if I want to describe this new system today, I will call it Swiss knife 2.0, and I will add even an S on it for showing that it's very, very, very special. So if we show you the technical aspect, because we'll not have a lot on this, you can ask people, engineers, to tell you. But if you are using a normal transducer, you have one row of crystals, and the new system here has, for doing the scan, 64 crystals in one level and 128 in the other one. So we have a high technology probe you are using, and we'll show you some images which can be acquired with this system. So if you have a system not having mechanical but electronic 4D, then the first thing you will think about is how are the fetal movements. And very soon you will realize that these are really very quick images you can acquire, like with a larger volume, like fetal face and baby moving, you will have between 7 and 10 volume per second easily. But also you can increase the resolution to see some grimace of the fetus, like in this case. And you can imagine that the first thing I will do, and I was doing, is to check the heart. And this is the heart here at 28 volumes per second. You can do it on a live mode, and you can examine this fetus. You can add the display, the surface display. You can look at inside the heart, and you can move the volume to look at out and in. And you can cut as you want and how you want, because you have rapid image calculation. And this is here a volume. When you see we are running at 37 images per second, where you can scroll from the upper abdomen and you can move the transducer to get to the great vessels. That means this is today feasible, and we can rely on a live probe to look at the heart. And Dr. Devore will speak today and the next days in his masterclass on this technique, and which is very exciting. We can use this also to get the usual other planes, like by using OmniView, and you can have a look to the valves while here scanning the 4-chamber view, but also you can add color or power Doppler to it and have a view either on a single plane or in the volume. You can switch to tomographic imaging, rotate the image, and have a complete look at the tomography where you have the complete view within these things. And Dr. Abba Hamad will also show you some recent aspects on the VCAT development under this condition. But this is theory. In practice, ideally, you will have a fetus not moving, and you would be happy if you have a good live scan. But if the baby is moving, you need a very quick stick. And this is the new stick we'll see later on, which is the E-stick, which is very rapid, up to 3 seconds, and then you can have a simple calculation. An exciting tool is the biplane, where in addition to the plane you are scanning, you can have an orthogonal plane. Some people think, do I really need this? But once you start using a technique like this, you will get used to, because you will have a look on the same time to the profile, and here you see the palette. You can get a cross-section of the eyes I showed you before. This is why once you have a new tool, you will try it, and then you will find a place in your everyday work for this. Even for the heart, by getting a longitudinal view, you can take the line and scroll up and down from before chamber to get the 3 vessel within a sweep, while looking here to the non-moving baby. So you can, I guess, use the biplane for several purposes. And I show you here another application like the septum, where you can see exactly the line along the septum. And it was obvious that the first case I had, then after this, when there was a ventricular septal defect here in this plane, then I was trying to show it in the other plane as well. And you see here that the VST was seen in one and the other plane, and which was shown clearly. But if the fetus is like another way, you place the line along the septal defect and you confirm it in the other plane, and this at a high resolution picture. I think another interesting application could be, for example, the level of the spina bifida, where you have it here on 2D, and you see where you are scrolling, and you can recognize the level at the spina bifida at this plane. And there are, of course, other applications I will not go through, but this was an interesting case. I was looking to the gender, and I was surprised that on the other plane, I saw what the girl was doing here, as you see. I haven't seen it first because I was still focusing on that, but the lady was seeing that the other plane. This is also a potential use. So one of my preferred uses is the so-called VCIA. That means what I call a scan with a slice. In general, when you do 2D, you have one plane, and you have acquiring volumes. You have a kind of large box where the complete information of the box is rendered. But what you can decide to do is, instead of having one plane, you can have, let's say, narrow slice of several planes which are each other, with a let's say width of these between 2 to 3 millimeters and 10 or 15 millimeters. And what you can, a good example to explain you this is, for example, a hand. If you look at the hand, it's not rarely open in one plane, and you have to move up and down until you see the complete hand. But if you take a slice and you make a projection like the transparency mode, then you can see it here easily. And look at here, this is an example. You see here the hand in the by changing the position of the transducer. But if you get an VCI, in this case, it is 6 millimeters that you can see the complete hand. And yesterday, Larry was showing us on his live demo. Another example he was citing, and I show you an example of this, is the hemivertebra. You see here, because we have a slice of the spine, you see the complete part, and this is here the region of the hemivertebra, which is easy to recognize and is highlighted by this slice. I show an example which make things, let's say, well illustrated. This is a descending aorta seen on the left side of the body. If you go to the right side, you see the inferior vena cava. Both are not in the same plane. If I take a slice and make a kind of projection of minimal mode, I can show both together within one picture. And if I decide not to continue with 6 millimeter, but to make the inversion mode, and by getting 8 millimeter, then I can demonstrate with a high resolution and with 20 images per second the IVC and the descending aorta within one view, to have a good documentation of both. So my favorite, of course, is going to be, at the end, color Doppler with HD Live. And this is here an example of an acquisition with glass body mode with stick. Now, I decided to look at only the grayscale information, and moving from right to left, you see here the mitral valve with the fish mouth sign, and then you see the stomach, and then you can scroll back to the right side, but then you can add the color Doppler, and using here, as you see this torch, you can change the direction of light. And this is here how the vessel appear. You see the pulmonary vein, the descending aorta, the inferior vena cava, the ductus venosus. And this is a projection where you can recognize the relationship of the vessels one to each other, and that you can rotate the volume and even change the direction of light. So if you want to see the lower part, and these two pulmonary veins are not well appearing in this plane, but then you can rotate everything to have the best look to the heart as you want. So in other words, what I'm trying to show you here is the same what we know from images or from pictures on cardiology, where you see the right and the left ventricle and the crossing of the great vessels, like in a model, but here in true life in a fetus at 22 weeks. Some clinical examples. This is one you can, I'm sorry, this one you can see here at 22 weeks, and today I showed you on a live demo that if you have good conditions, you can even show it in early gestation with the crossing of the vessels within one view. And this is here a clinical case of a tetralogy of Fallot, where you recognize the narrow pulmonary artery in comparison to the dilated aorta, or in this case, where you are focusing on the vessels, the aorta arising, and the pulmonary artery crossing over it in comparison to a transposition of the great arteries, where both vessels here are having a parallel course to each other. The pulmonary, as you see here, arising from the left ventricle, and you see even the bifurcation. With the effect of light, you can have a better impression of depth for these images. And this is here another case with the hypoplastic left heart syndrome, when you see the reversal flow in the aorta, not very good seen on a regular plane, but here you see with this technique is extremely well recognized. And for tiny vessels, a ramification of the aortic arc, here is the aberrant subclavian artery, and this is double aortic arc. You see the right arc, the trachea, the left arc, and the ductus arteriosus as the third arc in this plane. So, and then last but not least, for this clinical example, getting a view from the left side, you see the IVC, the inferior vena cava, the two pulmonary veins, the descending aorta. In this case, there is no inferior vena cava, but you see here behind the aorta, the azygos continuity having direction toward the heart, and this is here the descending toward the body. So I want to finish by showing you in a clinical example how I can use the machine as a Swiss knife, and how, if you have even a simple case, but how you can use the 3D and different tools to demonstrate things. So this is, let's say, a picture of a head, and you see a large cystic structure within the head. The experienced person will say, I know it looks like a arachnoid cyst. Some beginners say, but it could be also vein of Galen aneurysm. But let's say if you take, first of all, a tomographic imaging view, then you have a complete view of the brain. You see that in the upper part, the cortex and lateral ventricle are fine, and the posterior part looks fine. Then you can use the biplane to see here the surrounding structure, and you see the shape is cystic or circular in all directions, and you see here the cortex appears well. Then you can use the omni-view to see the relationship of this cyst in comparison to the corpus callosum. That means it is just under the corpus callosum, where our galen will be present in the posterior part. And then you can use the PCI-A plane as a slice, and you see the relationship to the cerebral peduncles. And I was trying here to get a view to the chiasma, but I was hindered by the shadowing at this stage. And then you can add the VCI-A with an inversion mode to see the shape of this structure with the volume. I could have also calculated with the sono-AVC the volume of this cyst, and then moving transvaginal to see the appearance here, and adding color Doppler to see the vessels surrounding. And you see here, you can clearly see that there are the two pericallosal artery present in this fetus. You see the internal cerebral vein, and you see here the posterior, the vertebral and basilar artery going there. And then by calculating a volume, this is the result, and this is how it appears on a 3D, and especially that you can appreciate also the presence of the both internal cerebral artery. In the other case, if there was a true vein of Galen aneurysm, you will have seen a lot of colors in the brain. And this is another example I've seen in June at 22 weeks, where you see the large dilation of the vessels and the large vessels within the brain, and with this cystic structure of a vein of Galen aneurysm. So I would like to thank you for your attention, and make you curious to use this machine.